Hello. Today we are going to talk about ankle joint, especially what happens when it gets fractured or becomes unstable. That is ankle fracture. So let's take it step by step. We learn what is an ankle fracture, types of injuries, what is ankle instability, how it affects movements. Yeah, coming to what is ankle fracture? So, ankle fracture means break in one or more bones of the ankle, that is tibia, fibula, talus, and stuffs. So, coming to the types of ankle fracture, malleolar fracture and its classification. So, firstly, it is supination injuries. So what is supination? Supination means the foot turns inward and upward. So coming to supination adduction injuries happens when the foot is twisted while the ankle is lifted and causes vertical and slanted fracture of the malleolus. So may also tear the ligament, that is lateral ligament, and shift the talus bone inward. So coming to the supination external rotation injury, this is the most common type, as we all know, causes an oblique fracture of the fibula and possibly a fracture of medial malleolus, so may also tear the deltoid ligament as well. Now coming to the pronation injuries, the first one is the pronation abduction injuries. So generally pronation means the foot turns outward and downward. So in pronation abduction injury, it breaks the malleolus, that is medial malleolus. So may crush the fibula and disrupt the ligaments around the ankle. And coming to the pronation external rotation injuries, it may break the inner side, that is medial malleolus, and damages the ligaments that holds the tibia and fibula together. May also cause a posterior malleolus fracture, that is back of the ankle. So coming to the Potts fracture, so let's not forget Potts fracture. So it is named after Percival Pott in 1765. So it is a combined injury that includes a rupture of medial ligament or fracture of medial malleolus. So fracture of lateral malleolus, the entire ankle shifts outward. So this is a serious injury caused by twisting or rotating the foot. Coming to the vertical compression fractures, so these happen when a person falls from height, land on their heels, and it leads to a crushing injury of the lower tibia, also called as pylon fracture. These fractures go into the joint and are hard to treat really as well. Yeah, the next one is the most important thing, that is chronic ankle instability, that is CAI. Sometimes after injury the ankle doesn't heal fully, so this leads to chronic ankle instability, or which is commonly known as CAI. This means the ankle keeps giving away, feels weak and twisting again and again. Sometimes the symptoms may include pain, swelling, and feeling of giving away. Trouble walking or running kind of stuffs also might happen here. Yeah, coming to the types of instability, so there are two types, as we all know, that is mechanical instability and functional instability. So the first one, that is mechanical instability, it happens when there is a problem in bones or ligaments. The bones do not fit properly, the ligaments are loose or torn, joint may not move correctly. All these leads to mechanical instability. Whereas coming to the functional instability, it is caused either because of muscle weakness, delay in muscle reaction, poor posture, or foot alignment, and nerve signals may be weakened. So in such cases it might happen. Yeah, coming to the more about functional problems, muscles react slowly after injury, their walking patterns change, and stuffs might happen in such conditions. And coming to the mechanical instability, that is ligaments, it is due to injury or constitutional hyperlaxity, and proprioception dysfunction might also happen here. So muscles may have serious nerve issues, their walking pattern also change. So the posture problem, like hindfoot varus, can lead to long-term imbalance as well. Yeah, that gait analysis lastly will include the increased dorsiflexion of first MTP joints, clawing toes, uneven pressure on foot, pain on the outer foot, difficulty in wearing normal foot might also be resulting in. Sometimes increased pronation supination index and lateralized foot pressure might also be happen in such cases. Yeah, some other morphostatic signs include unequal limb length, varus equinus, genu varum, and adductus foot, forefoot pronatus, and dynamic supination during weight bearing, and clawing of fifth toes. That is, or sometimes a callus formation might also be happening under the fourth metatarsal head. So all these together will lead to ankle fracture conclusion. Yeah, this is all about. Thank you.